Hello everyone, welcome to KSG 3606 Ethics, and today we are going to talk about confidentiality. So, why confidentiality is very important? Okay, because as we know, as a mental health professionals, okay, whether you're a psychologist, psychiatrist, counselors, okay, any profession, social workers, what happens is you are working with humans. Okay, we are working with humans. Your clients come with various stories. There must be some great happy stories, there will be very sad stories. People come with problems, come with issues. So in such cases, they tell certain things that might get very close to your heart. Maybe some cases touch your heart. Some cases might be very funny to you. Okay, so in such cases, we as a human being who listen to all the stories tend to share with people. Okay, we tend to share with people because we live in such a situation. Okay, when we encounter some interesting part, there is always an exchange of information. We talk to people, we share about our daily life, what happened to our work. Especially if you are in a family, you share how your day was, how was your work life is. Sometimes with your own colleague or with your own group of professional people. So there is a tendency of sharing information. So when we start to share, there comes the problem. So how far are we sharing? Okay, that becomes an issue, because when your clients or your patients tells you stories or tells you information, they expect that information are kept confidential. The document they shared, the experience they shared, with the hope that everything will be under confidentiality's umbrella, so nothing goes out from the session, from the room. But as we said, as a human being, we have tendency of sharing. Okay, so that's when the practitioners need to be very very careful when they are sharing. Sometimes they share to learn, sometimes they have to share to let go of the feeling. Okay, one of the example is a friend of mine who have been doing a lot of voluntary work with refugees. So when she was meeting a lot of clients or war victims or refugees, it was affecting her mentally. She's a very strong woman. She's very professional, but it was still affecting her. So because you feel like, okay, sometimes we feel like we have a better life than them. You feel very sorry for them, so you cannot actually progress with your own daily life. So these information from the field, the experience you get from the field, tends to dominate you, tends to capture your mind, your thinking, your energy. So in some cases they have to find a way to balance it out, to get that feeling out of them, to show that they have to balance between the work and their personal life. Okay, so in such cases, this friend of mine was talking to a was getting some professional help. It's not because she was sick, but she wanted to make sure that it doesn't affect her daily life, that she can actually rationalize what is actually going on. So she needed somebody to talk to. She needed somebody to talk through what her thinking is, so that she gets more clarification on the issues that's going on around her. So that is one way of people doing or trying to maintain confidentiality. She was not going around telling about the client situations, but she was more on telling how these things are affecting her. So how that she needs to overcome it. Okay, how she needs to build herself more stronger to hear their stories, at the same time not get too emotionally attached to them. Okay, so sharing is important. So when you have such problems, when you feel like you are into the profession and there is a lot going on, there is a lot of issues, but you feel like it's keep bugging you, it's time to get help. Okay, so that you still maintain the confidentiality of the information, of the documents or anything, but at the same time you are also getting help for yourself. So, confidentially is different from privileged communication. Okay, confidentiality is an ethical duty to keep whatever information, identity of the client in a pretty much like a very in a secret information, like it's a high level of secrecy. Okay, so we have to make sure that whatever they shared keep really as a restricted document. Nobody can actually have access to it. But when we talk about privileged communication, it is the client's right to prevent a court from demanding a mental health professional to reveal. Okay, so earlier we said that if the court asks for the documentation, then we are obliged. But there is also a term of privileged communication when the client also has the right saying to the court, well, I cannot disclose, I don't give any permission for the court to take in the or reveal the material of my mental health information or providers. Okay, so for this privilege is actually for preventing involuntary disclosure. So basically, like when court asking is pretty much like involuntary, whether you like it or not, you have to present. But in privileged communication, you can actually say, no, I don't want to share that. Okay, I have the uh, rights to deny, rights to say no for people to get access to my records. Okay. So APA, the Code of Standard 4.05, and talking about disclosures, it says that psychologists can share the information without the consent if the purpose is actually to get professional services. Let's say that if they are moving out of town or they are moving to a different state or moving to a different hospitals, so they actually have to bring all their old records, like to say like what is actually happened, what was the treatment that they've been going through. So actually they can get that information to the new place or obtain appropriate professional consultation. It's if they are trying if we are having a team of a treatment group. Okay, let's say that you are trying to get an advice from psychiatrists, so you need to still explain and show the case summaries and any of the activities that they have done so that they can get consultation from a professional. We want to protect the client or the psychologist or from others from harm. Okay, this is again like we want to protect them from being brought to the court. Okay, so in case that you want to show them that they're not guilty, they actually was did it because of certain circumstances, because of their medical problems. So in such cases we can actually disclose the information about the client. And in case if there is a payment for service from a client which is necessary, okay, to achieve, meaning that if you have like you need to sue your client, or you need to show that the client need to pay. If you are a private practices, you need to get money for your services, then in such cases you need to show them what are the sessions that you have done it, maybe the outcome of it, not all the details, might maybe the summary of it, very brief information, so that people understand that there was actually evidence of having sessions, and it is right to actually get paid for that sessions. Okay, talking about confidentiality and special population. Okay, we also have to understand who our clients are, who is the patients that we are, or patients, or our client, or our service receivers are. Okay, so we have to understand the nature of the population. So if they are children or adolescents, we need to also be cautious about the confidentiality issues with them. Okay, we have to honor the confidentiality in most of the same ways as we do with adults. Okay, we have to make sure that we protect whatever they say. We have to make sure that all the information about the children, the adolescents, are kept securely. Okay, we should not identify these individuals same like adults. We cannot label them. We cannot put their pictures and then put it on your wall saying that, okay, these are my patients and stuff like that. Okay, so we have to honor them same like we honor the adults when they are sharing with the psychologists or any mental health providers. But we also have to understand that they are minors. Okay, they are people, they are a group of individuals who um, who need to also inform their parents, who are still under the guidance of a parent or a guardian. So we also need to inform them, okay, about the sessions that's going on, the information that's being shared. So in case the children share certain issues, parents might be wondering, what did my son say, what did my daughter talk about it? So in such cases, it's not necessary for us to tell everything in detail, but we can actually say in a summarized more format. Like, maybe they've been talking so much about hatred feelings. You just say that, he or she develop a hatred feeling. So it is not like giving them every detail of it. Maybe it's just like a overall discussions, because they also have the rights to know, because they are the parents and guardians. Another thing is, it is more effective if we bring in the parents into the session, into the process to help, because whatever in help or assistance that is being given to the children, when they go back to the environment, they need that support. They need that a constructive environment where they can bring the change, or if change is required in them. So in order for that, parents and the guardians might be the most suitable people to work the interventions together. Okay, to create the intervention together with the mental health providers, so that they can implement it at home. Okay, so when a child is being brought in for an issue, it's important for the parents to know, so that they can cater the needs of the particular child. Okay, so if it is an autistic child, so at least parents know what to provide them. So parents can actually join in the sessions, in certain sessions, or maybe just to observe what's happening, and then maybe to learn together how to handle this the child. Okay, so it's important to honor the confidentiality of the person, the records of the child or adolescent, or the sharings, but at the same time there is a limit as well. Okay, limit same as the adults. At the same time, we also need to be possibly include the parents in, or inform them, because I'm sure they are interested to know what is actually going on, because they are sending it to get services, help, because they want to see a change. So in such cases, it's important for us to share that with the parents as well. Okay, next is group and family counseling. So when you in mental health, it's just not only doing individual counseling. There are also sessions when involve a family, or husband and wife. Okay, or and such sessions. So in those kind of settings, we can actually inform them that confidentiality, whatever the information shared, whatever documents that's brought into the session, okay, with the counselor or the psychologist or any mental health providers, are confidential. So you can tell them, if a family comes in, you can say that, okay, okay, family A, welcome to the session. So we are going to talk about an issue A, B, C. So you can inform them that, yeah, whatever that we discuss in the session ends here. Everything will remain confidential, but it's my responsibility to keep it confidential on my end. But we also need to, but I cannot guarantee that your members to keep it confidential. So it's everybody's responsibility to keep the sharing within this session. We should not be disclosing information about one another outside of the session. Okay, so we have to create that awareness that we can, among the family members, that we cannot just simply go out and share about it. Okay, and as a service provider, whether you're a counselor or you're a psychologist or you're a psychiatrist, any mental health provider, so if you're dealing with a family, you have to ensure them that you will keep things confidential, but you cannot assure for your other family members. So if things leaks out, or if things gets out, the word get out about your family, then there is possibly your own family members who actually release the information. So they cannot solely become the responsibility of the counselor or the psychologist. It could be because of people in the team. There could be other family members who disclose the information. So the emerging challenges to confidentiality. Okay, I think until 2019, most of the health care services, such as even medical health care, mental health care, whether counseling, psychiatric, any clinical psychology sessions, all these sessions, all this help has been conducted via face to face. Okay, so client has to make an appointment and they have to go to the hospital or a clinic or even a private practice centers to meet with the mental health providers. What happens is, during the pandemic, it actually changed a lot of the aspects. It actually brought a different paradigm to health services. Okay, because a lot of time what they did was, there was a lot of online meetings, online sessions, or in some cases it's just like an app or something like that. So there is a lot of influence of internet in this profession, in this service providers. So in such cases, again, how about the confidentiality of the information shared? There is a lot of hackers out there, so information such as the personal information, what medication, what is the health status, all this can be easily accessible. And when you're doing sessions, online sessions, how are you going to ensure that there's actually nobody listening to your client? Okay, where are you even sitting in your house? Is there like somebody walking behind you? So all that brings out issues of confidentiality. So as much as it helps to reach out to the clients better, internet is helping to reach out to the clients better, but we still have issues of the security of the data that's being stored on the patients, and also about the how much confidential information can be stored, how confidential is the situation, how confidential environment are we in when we are sharing with the clients. Okay, so in conclusion, people reach out to mental health providers thinking that they can get help. Okay, people coming with the hope that their problems, their issues can be sorted out with some help, with professional help. So when we say professional, it is a place where there is no issues of judgmental. There is a place where a secured environment is provided for the client to share their issues, to sincerely get help out of it. So, in order to provide a safe environment, firstly, the practitioners, the mental health practitioners, no matter counselors, psychologists, psychiatry, anybody in the field, need to provide or guarantee confidentiality, because at the end of the day, we are just regular humans. Okay, when we share, we hope that our issues are not being disclosed in public. Our issues are kept and are resolved in a very proper way. Okay, so we, especially when if you are a celebrity, people are very much interested to know about your life. So if you are a professional who is addressing or looking after a client or a celebrity client, so you have to have more precautions, okay, because you might tarnish or damage a person's image. Okay, so we don't want to have any of this discomfort to the clients. We have to make sure that we provide a secure environment for them to share their issues, share their concerns, and work out their problems, to have a healthier life, a better life. So first thing that a practitioner can give to the client is guaranteeing confidentiality. But we have to remember that confidentiality is comes with limitation. Okay, so confidentiality comes with limitations. So in cases where they request for the data, the court request for the information, or they are going to harm somebody, or they are going to take any and they are having any litigations against the mental health providers, or they have other litigations, or they are having or they are actually towards end of their life, they have any incurable disease, they are bringing they might cause harm to others, or they can cause harm to themselves. In these situations, we have to remember that it is the information shared is no more confidential. We have to breach or break the confidentiality bond or agreement, and we have to do the best for the client. Okay, so it is very important for us to remember the line, remember where is the boundary of the confidentiality. Not everything that your client says is confidential. There are things that we need to be aware and take action immediately. Okay, so these are an important element or quality or a skill that they need to understand. Okay, that the practitioners as a psychologist to be need to understand that confidentiality is very, very, very important. It kind of like a basis to build a trust between the client and the mental health providers. So in order to build that beautiful the trust that can help them to develop a proper intervention plan, so to help it out, confidentiality is a big thing. Okay, so that can help us to reach to the clients and then help them out. Okay, so that's all. Thank you very much.